In the name of God, hello students. Our topic today is lymphoid organs. At this slide you observe the central or primary lymphatic organ, thymus. That is a site of T cells differentiation. We have T cells inside thymus. Thymus also has dual embryonic origin, one from endodome that compose the stroma, epithelial reticular cells. Do you remember? And one mesodermal that are the other cells. And in the thymus, we have one capsule that surrounds it totally. This capsule of connective tissue penetrates inside it, thymus, and divides thymus to the lobules. We have lobules, incomplete lobules inside thymus. In each lobule, we have dark cortex full of lymphocytes and light medulla that we have also degenerating corpuscles. We call them hostile corpuscles inside the medulla of thymus. So we have one lobulation that is incomplete. The lobules separated by connective tissue, and each lobule has dark cortex and light center with hostile corpuscles at the medulla that are degenerating epithelial reticular cells inside the medulla of thymus. Then we go to spleen, largest lymphoid organ that is site of blood filtration. We have white pulps that are scattered in the whole of the spleen. We call them white pulp because these are light structures, but with the microscope they are lymphatic nodules. And in each white pulp we have one central artery. We observe it at the center or maybe at the corner of the white pulp. And also we have red pulps. Everything that we observe in the spleen except white pulp, we call it red pulp. The red pulp composed of splenic cords, we call them bilirubin cords, and also splenic sinuses that separated by these cords. And also you observe trabeculas. Trabeculas are protrusions, are expansions of capsule that this capsule also totally surround the spleen. So in the spleen we have one capsule of connective tissue, trabeculas that are connective tissue inside parenchyma of spleen, white pulps that are lymphatic nodules with central artery, and red pulp. In red pulp we have splenic cords and also splenic sinuses. Look at the red pulp, it shows you look at the spleen, it shows you white pulp, central artery, and the red pulp also, and capsule and trabecula. And lymphatic nodules, structures scattered in whole of our body, they are the site of lymph filtration. Each lymphatic node has one capsule surrounding totally. Between the capsule and the parenchyma is one marginal sinus that separates capsule from the parenchyma, and we have one part, we call it cortex, that composed of lymphatic nodules with light center. We call this light center germinal center. And also one medulla that composed of medullary cords and medullary sinuses. It shows you the hilus of lymph nodes that afferent vessel leaves the node, and afferent vessels reach to this part of the lymphatic nodule, that lymphatic node that we call this cortical sinus or marginal sinus, and it has many reticular cell macrophages. It here shows you cortex and medulla of lymphatic node. This is one slide that shows you the capsule. It shows you also trabecular that come inside the lymphatic node. It may has vessels and also nerves. It shows you cortical sinus or marginal. Also, we call it subcapsular sinus, and it shows you one nodule, cortical nodule with light center. I told you we call this light center germinal center, and also we have medullary cords and medullary sinuses in the lymphatic node. Here you observe marginal or subcapsular sinus. I told you we have reticular cell and free macrophage inside it, the lymph filters here, and we have one cortex, more lymphocytes, one lymphatic nodule in the cortex. We have more lymphocytes in the cortex of nodule, and germinal center that we have lymphoblasts that are lighter than lymphocytes in the center of the lymphatic nodule. Also, we have tonsils inside the between the lymphatic organs. In the tonsils, we have not one capsule that's surrounded completely, and we have epithelium. That this epithelium is like oral cavity here because it is Palatine tonsil. It is stratified squamous epithelium, produces crypts. These are tonsillar crypts. Beneath in the tonsillar crypts, they have lymphatic nodules. These lymphatic nodules also have germinal center. Look at the Palatine tonsil with epithelium, stratified squamous, and Palatine crypts also. Here shows you Pierce patches. Pierce patches are part of mucosal associated lymphatic tissue with dark. These are also lymphatic nodules. We observe Pierce patches at the end part of the small intestine. We call it ileum. In the end part of the small intestine, we have diffuse lymphatic nodules with germinal center. We call it Pierce patch. That's part of mucosal associated lymphatic tissue or MALT. Here you observe again white pulp and central artery and red pulp. Goodbye.